Syringe for blister management. You take a 5cc syringe, you take your zinc, hopefully it's at room temperature at this time. If it is not, you either heat it up with hot water or put it in the foot of your sleeping bag, and it should get to at least warmer than body temperature. All you do is you put this in here like this. You put in about 3 cc's of zinc. Doesn't have to be perfect. You put the plunger back in the syringe. You bring it up to where just a little bit shows through the outlet. Then you retract. Once that is done, depending on your needle size choice, this happens to be a 22 gauge 1 inch. Put the needle on the syringe, take the cap off. It's always a good idea to have a little bit of gauze with you because it may bleed out a little bit. You push it through to where you see the zinc exit the syringe. Now, believe it or not, this zinc is at room temperature and it's kind of difficult in the plunger to get out. You can always wrap your hand around it to warm it up a little bit. But this would be the syringe that you would inject about half of the volume of the blister once it's aspirated with zinc. At that point, you retract again. You can recap if you choose to. You're going to have to anyway because this zinc is still good for other patients. Take the needle off. There's no cap, so put a new needle on with a cap, and it's ready for a new patient.
Okay, so let's pretend, Mike, that I've got a blister on my arm, and now you've aspirated that with a 25 gauge needle. The idea being that you don't want the hole so big or the rent so big in the blister that it will fall apart once you inject the zinc. So you've aspirated my blister, which I'm not showing very well. There it is in green, with a 25 gauge.
Or a needle of your choice. It depends on the size of the blister and the viscosity of the fluid that's in there.
Okay. And if the blister at all looks angry or infected, then you might want to mix with that zinc solution some topical antibiotic.
Correct. Or you could have multiple syringes set up. You could have one syringe with mupirocin 2% in it. You can have one syringe with zinc and just change the needles and mix them together.
Okay.
Okay. So you would aspirate that. All the fluid comes out, whether it's blood or whether it's just basic liquid. Once it's been removed, then you would inject with the zinc or the mupirocin or the mix to about halfway. There's still going to be a little bit of laxity in the tissue. At that point, once it's there, these pads, depending on the extremity that has the blister, most likely ankles or in between toes, and the toes are kind of a different issue, but let's say it's on the heel, for example. So you would take one of these self-adhesive foam pads, you would cut out an area large enough to completely surround the blister. You put it over the blister itself like this. It doesn't have to be perfect. When you get to that point, you will have jars of skin lube that are readily available. You will take the skin lube, and I'm just going to use this, but there are tongue depressors that are available. You take that skin lube. You can cover the blister with a Band-Aid if you choose. It's not really necessary. But now you cover the entire hole of the cutout with the skin lube. At that point, depending on the size, you either seal that with a Band-Aid, a 4-wing Band-Aid, or there's going to be plenty of Coban on the trip. You wrap it up with Coban. When you do that, use a natural tensile strength of the Coban when you're wrapping it, because if it gets too tight and they start the hike and they go up to altitude, or it's a long hike, let's say Grapevine, that's going to swell. Kids are going to become uncomfortable. They're going to want to take it off. Then all your work is lost. But that's, and let me show you how I would close this area. What I would do is, at this point, this is Coban. It just happens to be red. I would just wrap it around to where you can't see. You where you can't see the padding. Once that's in there, what's going to happen is over time that skin lube is going to impregnate the co-band. That's going to lean against the sock, and there's going to be plenty of lubrication to last them throughout the entire hike. Now when you get back to base camp, whoever's treating this, all this comes off. You clean it with a little bit of alcohol, making sure not to rupture the top layer of the blister, and you just evaluate it for any signs of worsening. If it's not worse, I would recommend flip-flops for the night and then redress it in the morning. No aspiration is necessary. No re-injection of zinc is necessary unless the blister has ruptured, and then you have to do it all over again. But we'll go over what to do with a ruptured blister in the next segment.